Thank you for holding such an important hearing for our initial kickoff as a committee, and I want to thank the witnesses for your testimony. And I'm so happy to hear such wide bipartisan support for the need to protect individuals with pre-existing conditions. It's just fundamental in our healthcare system. I'm glad to see that consensus developing. Mr. Robertson, let me ask you, and listen, I'm an owner of a family farm myself in a large rural western Wisconsin district. We rotate corn and beans, have some beef cattle in, so I'm operating in farm circles quite a bit. And I'm glad to hear that you're coming up with a solution in Nebraska with these AHPs that are addressing one of the shortfalls, quite frankly, that existed under the Affordable Care Act. That's those individuals trapped in the individual marketplace that are not qualifying for premium tax credits to lower their health care costs. And you're trying to address it right now with the AHPs. Clearly, it's not something that's prohibited under the ACA because the Nebraska AHP is ACA compliant, which is all that we've been asking. The concern with the AHPs, though, is if it wasn't ACA compliant, they'd be offering junk plans that wouldn't cover very much, and therefore offering them cheaper, and it would strip a lot of the younger, healthier people and gravitate to those plans as to the more comprehensive coverage that virtually all of us ultimately need at some point in our life. But let me ask you a couple of questions, because I'm dealing with the same issue in Wisconsin. The average farmer's age in Wisconsin, 60, 61, like you said it was in Nebraska. Are you worried with the health pool that you've established with the AHP, with the average age about 60, and the fact that as we grow older, we consume more health care? Health care gets more expensive, and what that's going to do with your premiums in the future, with that aging population within your health plan?
No, we're not. I mean, we built this plan to last for a long time, the next 5 or 10 years, and so we built it to be ACA compliant. And we think as we grow the pool, we hope this thing becomes not just 700 members, but it becomes 3,000, 4,000, 5,000 Farm Bureau members.
Are you also worried about maybe the extraordinary event that might happen with some of your members, whether it's cancer, with the extraordinary costs that might come with 1 or 2 individuals contracting cancer and having to deal with those expenses, what that might do with the AHP premiums in the future?
Yeah, I mean, that's always a concern because you have to have an association health plan that remains solvent. And so there is that concern out there, but again, the track records will show with all these large employers, the larger the group, the more you can address those type of large events.
Great agreement on that point. And it was just interesting because I did encounter this article on the World Herald Bureau written by Joseph Martin talking about Nebraska AHB plan. And Mr. Chairman, I'd ask unanimous consent to get the article included in the record at this time. But in it, Mr. Jeff Barch, who's Medica's vice president, who's offering the health plan for you, was asked how the initial premiums were established, and he was quoted as saying, "We had an opportunity to just assess who the potential association members would be, and their health risk is lower than the remaining individual market." And that's why you're seeing some better premiums being offered. But he also pointed out there are over 90,000 people in the health insurance exchanges under the ACA in Nebraska who are still in that pool. And the vast majority of them are receiving premium tax credits to lower their costs. I know in Wisconsin, I don't know what it is in Nebraska, but 87% of the participants in the ACA Health Insurance Exchange in Wisconsin are qualifying for these premium tax credits, substantially reducing their costs, and that's why so many have signed up for it. But Mr. Barsh also went on to say that the association in our mind is really targeting, again, either people who have left the market already or those people who are still in the market but don't receive a premium tax credit. So that's the issue, really. The roughly 5–6% of the overall population of the country, Mr. Barsh says that's just such a small overall portion of the overall population that fits that definition. And that's one that I hope that we could find some bipartisan agreement. How do we address that small portion of the American population stuck in the individual marketplace, not qualifying for premium tax credits? I know Mr. Neal and others of us have offered legislation to address that by expanding these premium tax credits to cover more individuals, and that's another way of addressing it. But I'm just concerned that with demographics, with an aging population, extraordinary health events, such a small pool of 700 members, and you're hoping to grow that, what that might do to future premium. Let me finally ask you, most of your members, when they hit 65, then transfer into Medicare?
Yeah, they do.
And Medicare is a great program, and they have to take all newcomers, whether you have a pre-existing condition or not. And Medicare is able to spread that risk out. Do you have a prediction that if there was an early buy-in option to Medicare that's budget neutral, that some of your members might find that an attractive option?
I do not. No, I'm just here on the association health plan, but I appreciate
enough.
that.
That's fair enough.
But on your point on the federal poverty level, we even saw those members who are in the 250 to 400% federal poverty level, actually our Farm Bureau plan competed with that tax credit, and we were able to pull some of those away from that tax subsidy or that premium subsidy. So that was good news.
That's good. We'll watch it very closely. Yeah. Thank you. Thank you all.
I thank the gentleman, and with that, I'd like to recognize the gentleman from Missouri, Mr. Smith. And after Mr. Smith inquires, we will move to establish precedent on the committee, having 2 witnesses on our side for 1 on the other side. With that, Mr. Smith is recognized for